Good evening, friends. After a gap of a day, we'll start with new session and new topic from the 6th edition of Organ of Medicine. We have finished up to the 209 aphorism and the homeopathic management of the chronic diseases, out of which the homeopathic management of one-sided diseases, which we have finished. He started right from aphorism number 171 and up to the 209, the homeopathic management of chronic diseases, out of which one part he has finished related with the homeopathic management of one-sided diseases. We have to begin with the homeopathic management of mental disease. In fact, it is the one of the important topic both from practice point of view as well as from the exam point of view. I think there are many new students who have joined today's session from Shirpur also. A warm welcome to all of you for this Organon session. And those who are doing fourth year VIHMS, third year VIHMS, my suggestion for you, whenever I will going to tell you, yes, this is the topic which is important from exam point of view, always keep a mark over there and read that again and again from the 6th edition of Organ of Medicine. So we have to start with the mental diseases. So we'll start directly with the aphorism number 210 because it is the beginning with which he starts with the mental diseases. So let us read first the 210 aphorism. What he says over there, of psoric origin are almost all those diseases that I have about termed one-sided, which appear to be more difficult to cure in consequence of this one-sidedness. All their other morbid symptoms disappearing, as it were, before a simple, great prominent symptom. Of this character are what are termed mental diseases. They do not, however, constitute a class of disease sharply separated from all others, since in all other so-called corporeal diseases, the condition of the disposition and mind is always altered, and in all cases of diseases, we are called on to cure. The state of patient's disposition is to be particularly noted, along with the totality of the symptoms, if we would trace an accurate picture of the disease in order to be able, therefore, to treat it homeopathically with success. So see, he starts with explaining about the mental diseases. Most important thing which Hahnemann tried to explain over there is there is no difference between the constitutional physical corporeal disease and at the same time the mental disease. Because whenever we are dealing with the patient, we are dealing with the mental aspect, the state of disposition and mind, even though the disease is corporeal. Corporeal means physical. But whenever the disease is mental, we have to take into consideration vice versa. Both diseases are part and parcel of human being. The mind is not separated from the human being or human body, and body is not separated from the mind. The soul is not separated. Without soul, we cannot consider the human being. So this trinity is always together. For our purpose of understanding, we separate them. It is only for our comprehension. Means only for understanding purpose, we separate mind and body and soul. Ultimately, they are unique one thing. So whenever we deal with the corporeal diseases, we have to take into consideration the mental aspect. And same is true when we deal with the psychological disorders, we have to take into consideration the corporeal entity. Both are necessary and they are one and the same. So whenever we deal with the one-sided diseases, being a chronic diseases, mental diseases are nothing but the chronic diseases. They are the part and parcel of it. So this is one important era or area on which Hahnemann concentrates. There are many mental pathologies and they are very difficult to cure. If you look towards the psychiatric practice, you will find many people who are taking medicines, allopathic medicines, for months together. They are taking it long standing. Schizophrenia patient forever becomes schizophrenia. He never, I have not seen a single case who has cured from schizophrenia. I have not seen a single case who has cured from OCD. They goes on taking the medicine for years together. In fact, up to the level where it causes its own effects on the body. The pathology then turns from mental to the corporeal and damages the liver many a times. Such type of thing which is there because the disease is at a dynamic plane and treatment is at the material plane. And this is what happens with allopathic treatment. Then question arises, how to handle, how to tackle those mental disorders. For that purpose, my suggestion to all of you is that the understanding, the knowledge of those psychological disorders is very much necessary. From the modern science, you have to learn all those disorders. You learn by heart what is depression. You learn by heart what is obsessive compulsive neurosis. You learn by heart the paranoid schizophrenia. You learn all those dementia, all those psychological disorders which are present, and then open your repertory, find it out the symptomatology, correlate it with the disorder. You can find many more remedies. We have ample remedies to treat. But problem lies, we never likes to study those psychological disorders from the medicine. In fact, it is included in our syllabus. In fact, MHS had done our renaming of this organ subject, organ of medicine and homeopathic philosophy and psychology. This is the actual name, but we never goes with the study or aspect of understanding the modern psychology. My suggestion to all of you, go through that, understand them, and then you will find there are many more solutions in our homeopathy. We can treat, we can bring those patients out. Only thing is that we have to concentrate and we have to understand what the patient is presenting. It is so much necessary. Hahnemann have explained all the aspects. She has explained the 4 varieties of the or 4 types of the psychological disorders. But all 4 psychological disorders, he has explained different management. First variety, a different management. Second variety, different management. What exactly the first type? What is exactly the second type? All those things which he has tried his level best to explain in detail, so that how to manage all those, he explains over there. So this is what he wants to explain in this aphorism. And there is footnote. Footnote is related with the word conditions of disposition and mind is always altered for this sentence. So what exactly he wants to mean about exactly meaning of these conditions of disposition and mind is always altered. So there is footnote number 121. We'll go through that footnote. 121. How often, for instance, do we not meet with the mild, soft disposition in patients who have for years been afflicted with the most painful diseases, so that physicians feel constrained to esteem and compassionate the sufferer? There are few words which are little bit difficult. So if you don't know, write down the meaning. Afflicted. Afflicted means sharirik mansik dukha hone. Afflicted. Were suffering from physical disorders or bodily affections. Afflicted. Constrained. Constrained म्हणजे पेचात पडणं. कन्स्ट्रेंट म्हणजे पेचात पडणं. एस्टीम. एस्टीम म्हणजे मोठी किंमत मोजावी लागणं. एस्टीम. एस्टीम इज अ बिग प्राइस. कंपॅशनेट. कंपॅशनेट म्हणजे दयाळू, कनवाळू. So what he starts? He starts with this sentence. How often, for instance, do we not meet with mild, soft disposition in the patient, who have for years been afflicted with the most painful diseases, so that physician feels constrained to esteem and compassionate the sufferer. But if he subdue the disease and restore the patient to health, as is frequently done in homeopathic practice, he is often astonished and horrified at the frightful alteration in his disposition. He often witnessed the occurrence of ingratitude. Ingratitude म्हणजे कृतज्ञपणा. Ingratitude. Astonished. Astonished म्हणजे चकित करणे. Astonished. Ingratitude म्हणजे कृतज्ञ. Cruelty. He often witnesses the occurrence of ingratitude, cruelty, refined malice. मलाईस म्हणजे मॅलिस, मलाईस म्हणजे द्वेष करणं, दुसऱ्यांबद्दलची असूया, खुन्नस, अँड प्रॉपेन्सिटीज. प्रॉपेन्सिटीज म्हणजे प्रवृत्ती. प्रॉपेन्सिटीजचा अर्थ प्रवृत्ती. अँड प्रॉपेन्सिटीज मोस्ट डिसग्रेसफुल and degrading to the humanity, which were precisely the qualities possessed by the patient before he grew ill. When we do homeopathic practice, such types of incidences happens. I will share one example, which is very closely related with this paragraph. When this fellow, this case is there on my blog also. You can go through the blog, you can get that case. My blog, if you don't know, I will write blog and then blog. In the blog, that case, a Wala becomes Valmiki, that case was written. Actually, this fellow came to me for cardiophobia. He used to suffer with severe chest pain. He used to suffer from palpitation. He used to suffer from cardiac embarrassment. And continuously he was taking allopathic treatment. And when he came first time, luckily and fortunately, he explained whole life. As if he has explained the truth. He explained his real nature, how disgraceful the nature of this person is there. Everything. He has explained all bad aspects of his life. Everything he has explained. How he used to be a person who used to wander here and there, how sexual minded he is. Everything he has explained in detail. That was his state of disposition. In fact, that was the thing. The looks were suspicious. Looks were always like that. And he used to be a very, very clearly affecting with these material thoughts. And that material thoughts made him so much worse. The fear has developed in him. That has produced the cardiophobia. It was a wonderful case. You can go through that blog. A repertorization sheet is also attached by me over there. It is www.drprasadrasal.blogspot.com. And you get ample cases, ample things about Organon and everything. It is in 2010. You can go at the bottom over there and you can find it out in 2010 year. You can get this case. Wala becomes one. It's wonderful case. I have given medicine acid fluor to him. And after giving fluoric acid to him, he recovered not only from his physical problems, but his state of disposition and mind completely changed. Within a year, he had changed to exactly the opposite side. The person who was having bad character becomes a person of a very responsible, good character and got a prize of a best worker, health worker in next year from their specific society. It was wonderful change in that case. So First important thing we have to understand, even though you are treating the corporeal diseases, you are taking nothing but the state of disposition and mind. So in the similar manner, when you have to deal with the mental diseases, you have to go vice versa. There also you have to take into consideration what the corporeal diseases the patient was suffering before that, because that will guide you exactly the holistic aspect of that human being. You will understand the whole human being. You don't have you don't have to look towards the one side of it, that is only a psychological aspect or only a corporeal aspect. Ultimately you have to deal with the whole human being. You have to understand the mind, the soul, the disposition, the physical complaints, all you have to take into consideration. And then it is possible to understand these things. And for that purpose, he explained over there, whenever you are dealing with the corporeal diseases, you used to take into consideration the state of disposition and mind. In the similar manner, when you deal with the mental diseases, you have to take into consideration the same thing. Your approach never changes. That's what he wants to explain over there. Then further, he explains in the same footnote, those who were patient when well often become obstinate, violent, hasty, even intolerant and capricious, or impatient or desponding when ill. Those formerly chaste and modest, chaste म्हणजे सद्गुणी, modest सभ्य विनम्र. Those formerly chaste and modest often becomes lascivious and shameless. Lascivious means sexual minded, shameless, something nirlajja. So this is how a state changes. A person who used to be a very polite, very modest, but when he becomes diseased, the mind state of disposition changes. A person who was used to be a normal becomes abnormal at the mental level. And this is the change of disposition or change of state of disposition happens to be there during illness. And you have to catch this change in the state of disposition of the human being. Whether you treat the mental disease or whether you treat the psychological disease or corporeal disease, you have to take into consideration all those alterations. Those alterations, in fact, guides you towards the right remedy. Those are very important to find it out exactly the nature of that person and ultimately a remedy for that person. So it is too important to find it out that. And then what he further says over there. A clear-headed person not infrequently become obtuse. Obtuse म्हणजे मंद, सुस्त. A clear-headed person not infrequently becomes obtuse of the intellect, while one ordinarily weak-minded person becomes more prudent and thoughtful. And a man slow to make up his mind sometimes acquires great presence of mind and quickness of the resolve. So these are the changes which happens in the state of disposition of the human being. They turns from one state to another state whenever the disease happens to be there. And you have to find it out exactly this altered state of his nature, altered state of his disposition. And it is too easy to find it out. You have to take into consideration how the patient approaches. So we have spent two days to understand the state of disposition. Many examples, multiple rubrics already we have discussed in the previous lecture to understand state of disposition. So the way patient presents to you, ultimately you have to take into consideration his state of his disposition. Whether you are going to treat his physical features or whether you are going to treat his mental or psychological disorder, it doesn't matter. Ultimately, what you require is his altered state of his disposition and mind. So whatever may be the disease, this part never changes. And this is what he wants to highlight. Even though you are now dealing with the mental disorders, you have your approach used to remain same. It will never change. The way you are treating the corporeal chronic diseases, in the similar manner, you have to treat the mental chronic diseases. And this is what the meaning of this 210 aphorism along with the footnote. There is one more aphorism which we'll finish today, and then we'll go ahead with the 212 tomorrow. Let us go with 211. This holds good to such an extent that the state of his disposition of the patient chiefly determines the selection of homeopathic remedy as being decidedly characteristic symptoms, which can least of all remain concealed from the accurately observing physician. And this aphorism is the, in fact, most important aphorism to understand the homeopathy. Because state of disposition ultimately gives you exact individuality of the person. The person approaches to you with his state of disposition. It varies from person to person. Some persons calls you, they take your prior appointment, they calls you, they says that doctor, I understood your name for such and such disorder and I want to take treatment from you. At what time it will be better to have a treatment? At what time you'll have a free time so that I can consult you? This is the politeness. They ask you on telephone. You can understand. They understand the social norms. So that is their state of disposition. But there are opposite type of patients who used to come to you directly, just looking at your board, and they enter and they ask, yes, I want to take treatment for me. So you ask, why do you are here? Who sent you? They say that no one has sent, just I read over there. Then your name and I enter. So they are not serious about this, their diseases. Their state of disposition is not serious. They are in fact more frivolous. Frivolous म्हणजे काय? गांभीर्याने न घेणारे. First persons, they were serious, earnest, and that's why they called you prior to the point, prior coming to you. They take an appointment and then they enter. They are polite. So everyone comes to you with a different state of disposition, and that is their nature. That nature you have to catch. That is, in fact, the thing which will guide you towards the right remedy. The first few sentences uttered by the patient gives you idea how the person they talks with, in what way they talks is very important. So every sentence explained by the patient in such a manner gives you exact state of disposition of the person. Hahnemann says, whether you are treating the corporeal disease or whether you are treating the psychological disease, ultimately you have to give so much of importance to the state of his disposition, and that guides you towards the right remedy. And last sentence which he has explained over there, which can least of all remain concealed from the accurately observing physician. So if you are accurately observing physician, if your perceiving power is good, you catch the things very easily. The state of disposition, patient will not going to tell you, yes, take this rubric and give me remedy. It is you, ultimately depends upon you. You have to perceive what the patient is expressing. So the way patient presents is very important. There is one patient who comes to you, doctor, today morning I have got pain over here. Then it shifted to this time. Then again it shifted to this side. Then again it shifted to this time. 4 times it has shifted from side to side. He gives you directly a very important entity. So he is expressing his state of disposition through his nature. So headache, which is shifting from one side to another side, again coming to the same side, is very important. That is what you have to catch. That is his state of disposition. Everyone will not going to tell you same thing. So what is there? What is characteristic? Symptom alternates from one side to another side and again to the same side and again to the another side is the characteristic of which remedy? No, pulsatilla, it is
Lac
irrelevant.
caninum?
It is lac caninum. Correct. It is lac caninum, where there is shifting from one side to another side, again to the previous side. This is very typical with lac can. Lac can goes from one side to another and again to the previous side. This is lac caninum. If it is sore throat, same thing. If it is headache, same thing. If it is pain in abdomen, same thing. If it is backache, lumbosacral backache, right to left, left to right, this is shifting. Very typical with lac caninum. So that is the patient's state of disposition. So ultimately, you have to catch this uh, from the sentences which the patient utters. Then it is possible to get the remedy. Pulsatilla has a shifting, but it is not, it is random from one place to another, then another, again another place. It never remains in one place. It never remains in same direction. That is what is pulsatilla is there. So every time you have to catch all those things, the way patient presents, and that is what is called as the state of his disposition. Patient comes to you with very anxious mood and he sits in front of you and his face is full of anxious and he's just, doctor, may I get cleared? Is it possible? And he utters same sentence again and again, again and again. You can watch the anxiety expressing on his countenance. That is what is his state of disposition. He's become so restless. That that is what you have to catch, with which you can approach towards the remedy. They never sits in one place because of the anxiety. They become so restless. They goes out and again enters, again asks same question. There is one more question they ask. डॉक्टर हे लवकर बरा होईल तुम्ही लवकर बरा का प्लीज प्लीज the talks this sentence gives you something which is very essential with a lot of anxious mood. So there is anxiety with restlessness moving from one place to another place, carried desires to be carried fast, remedies arsenic album. This is what you have to pursue. So ultimately you have to pursue the states of the person, and whether you are treating the corporeal disease, that is physical disease, or whether you are treating the mental disease. Ultimately, your treatment depends upon state of disposition of the mind, and this is what he has explained in 211. This is, in fact, most important aphorism from this organ of medicine. So we'll stop over here. We'll meet tomorrow with the next aphorism, and then we'll turn towards the types of mental diseases. So thank you being there. If there are any queries, we can help. And there is one announcement: those who are used to remain in Pune they can have a good seminar on this Sunday at Pune Hospital. Venue is at Pune Hospital, and it will be between 9 to 1. And there will be a feast of rheumatological disorder and the homeopathic management part. So interested people should attend that seminar, a practical approach, in fact, in treatment of rheumatic disorders, which you can get over there. So thanks a lot. Thank you, Dr. Bhushan. Meeting you after a long time. So everyone is there. There are many new friends who are there. Thank you, everyone. Any query, any questions are there related with this topic, we can have a chat. Otherwise, we will conclude.
Hello, sir.
Huh?
Sir, is it necessary to treat patient with constitutional dose after acute disease every time?
It is not necessary to give the constitutional, but you can give the complementary to complete the cure. That is more important. Constitutional, if you are giving, it's well and good, but it is very much necessary to give his mathematic remedy to complete the cure. So if you are treating patient with the for example, with aconite and complementary is sulfur, and sulfur is in fact after every acute disease, you must give a few doses of sulfur in order to stop the recurrence. That is important. Not necessarily that person should be a sulfur. It depends. If patient is having chronic disease in background or chronic miasm in background, definitely you require the constitutional remedy. Okay.
Okay, thank you, sir.
Okay, we'll meet again tomorrow at the same time, 6 o'clock, and we'll have further aphorisms to be. Thank you very much.